By way of introduction, we have the Department of Economic and Social Affairs. We work very closely with different stakeholders. Our primary clients are governments, but we work with our, of course, UN colleagues, UNU, World Bank, WHO, UNESCO, we in UNDP, as well as civil society, academic institutions. And what we try to do is, in the area of disaster risk reduction is to impact. I think the main point for the past several years has been to impact on the knowledge base on disability and to explore how we can build capacity for DIDRR in relation to promoting disability inclusion in relation to policies, programs, guidelines. So this is our main issue in relation to promoting the disability perspective in disaster risk reduction. Okay, so the main issue that I like to talk about is the three issues: the status of disability inclusion, in terms of disaster risk reduction and emergency situations. We have some updates from last week, as well as from yesterday, not yesterday, 2 days ago, from the UNESCO meeting, as well as from the General Assembly, which adopted the latest resolution on the resolution. It's a long title. It is called the General Assembly Resolution, Realization of Millennium Development Goals and other international agreed development goals beyond toward 2015 development framework and beyond. So we have all of those updates. And second issue is, this is more standard issue, standard discussion that we engage, with all our stakeholders, is the United Nations framework to advance the status of persons with disability in society development. We talk about more normative frameworks, and we talk about how, in this area, we talk about the recent progress in terms of normative basis for us to build on, for us to develop policies, for us to develop programs and guidelines. So this is a very important area for us because this constitutes a fundamental basis for everything we do, and including, I guess, all UN-related institutions and all our member states. So I guess we all need to know this. Third discussion is about the ongoing work of the UN toward disability inclusive development. So this is, I would like to now then, just lastly, I would like to talk about what is it that we are doing right now, and then where we want to go, next steps. So these are the three points that I'm going to discuss. General situation, persons with disabilities. Yes, just 1 second. Yes, when we talk about the status of disability inclusion and disaster risk reduction, I think we know basic information. We have basic information, even though we don't have data statistics and information which has been systematically gathered and monitored. We actually know that people with disabilities are disproportionately affected by disaster, emergency, conflict situations. Recently, through the great Tohoku earthquake, we have now the evidence that mortality rates 2 to 4 times higher in disaster situation, and people with disabilities are most likely to be left in more vulnerable conditions than the population without disabilities. Because these are the basic things that we know. Most of us are without being in the field of disaster risk reduction. And when we specifically think about persons with mental and intellectual disabilities, we also know that they remain invisible even in efforts toward disability inclusion and development processes. Just to share with you one of the main points that was raised during the UNESCO DESA forum on accessible, inclusive, and sustainable development and technology was that vulnerable populations, vulnerable population among people with disabilities. In other words, when we talk about people with disabilities, mental well-being and those with mental intellectually disabled population do not seem to be included in disaster risk reduction. And there was a great concern expressed by almost half the attendees. There were about 50 to 60 attendees. And almost half the attendees all said that we want to see more efforts to be made, more studies to guide us, in relation to including people with persons with disabilities in disaster risk reduction. So I also heard from the grassroots organizations working in India, working in Nepal, in the developing countries in Asia. So I think in developing countries, those concerns are really also very serious and very prevalent. And then we also talk about, in terms of people with mental disabilities, intellectual disabilities, there are a number of evidence studies that show how severe human rights violations are committed in different contexts. And as I just mentioned, their situation in general, including human rights violation situations, needs and well-being are not necessarily included in policies and programs concerning disability. We have done some studies at DESA as part of the Secretary General report, borrowing from the collaboration that I discussed this morning. And disaster experience give rise to developing mental health condition and that is so all of those studies we start to have more evidence. We start to have more documented work in those areas that you can see in this slide. And so this is also continuation of information that we included in the Secretary General's report. And there's a growing recognition that disability is one of the most invisible issues in the mainstream development process, mechanism institutions. And this, coupled with actually lack of visibility to disability. So in other words, if we have more visibility to disability in the context of development, I think the mental well-being and mental health issue itself would also be able to get again, the visibility that it deserves and it requires. So these are some of the findings that I'm just sharing with you from the study that we did for the Secretary General's report for the most recent one that was issued in September 2014. So now I am just. This is a slide just to show. I can see this is a repetition of what I said. In our work, we work to advance the status of persons with disabilities in implementation of international instruments like the Convention on the Rights of Persons with Disabilities. We are a global focal point on disability, and we mostly work with governments, but we also work with civil society organizations and academic institutions. And we try to, as a global focal point, all this information that we shared with you and all of the work that we have been doing as colleagues and also as partners to actually to disseminate knowledge and to also to build on the knowledge that we already have to create a new platform for different stakeholders to take their own ideas to build further on disability inclusion. We also try to be like information clearinghouse, and we use for this purpose Enable website of the United Nations, which is now used by all member states to look into to keep abreast of what is taking place in the field of disability. And so there are some of the things that we focus on as the Secretariat of the Convention. Okay, so So now I would like to go to the second issue cluster that we discussed, which is the normative framework, international normative framework on disability and development. First of all, you may have heard of the Convention on the Rights of Persons with Disabilities, which was adopted in 2006. And it actually highlights the importance of nexus between human rights and development. And it actually guides the work that we do at the United Nations in the field of disability. And I think you may have read the text of the convention, but Article 11 and Article 17 contribute to this normative framework we are now trying to emphasize in this expert group meeting, which is normative framework based on the rights of persons with disabilities, but how we can actually elucidate the norms on mental well-being and mental health, which will contribute to the rights of persons with disabilities in a context of disaster risk reduction and resilience and post-reconstruction. So these are some of the examples of the norm. And I would also like to, continuing with the normative basis, I would like to also mention the outcome document of the General Assembly high-level meeting on disability and development. And this meeting took place last year, this time in September 2013, which actually was convened because there was a huge gap between policy and practice, commitment and practice, policy and practice. From the standpoint of the international communities, where we are in terms of disability inclusion, because you've had the convention, and before the convention we had two major instruments, which was the World Program of Action concerning disabled persons. We also had standard rules on equalization of opportunities for persons with disabilities. And there were a number of other instruments that are relevant, such as CEDAW, the Convention on the Elimination of All Forms of Discrimination Against Women. We had Convention on Rights of Persons, Convention on Rights of the Child. We also have other development commitments to disability. We have all of those commitments, but in 2011, the Assembly said that we don't really think the gap has been narrowed between the commitment we have to advance disability inclusive society development. And then when we look at the reality, it is not happening. So let's see how at the highest level of states, the governments, how we can actually just move forward more quickly to practice what we preach, to implement this commitment. So this is the background of the General Assembly high-level meeting, and then they actually adopted the outcome document, which strengthened the inclusion of and focus on the needs of persons with disabilities in humanitarian programming and response. And these some of the segments, some of the parts that you can see here are directly relevant to the work that we are doing in the context of mental well-being and disability and disaster risk reduction. So I just wanted to draw your attention to this. And then next, I would like to mention very quickly that this session, this is 69th session of the General Assembly. And General Assembly resolution, as I just already mentioned, adopted the resolution on 24th November, which is just this Monday. I received this information, the information that the General Assembly adopted the resolution just Monday, 3 o'clock, 3:30. So it's brand new. But this resolution is a very important resolution for us and for the international community, not only because this talks about the vision and then how to move forward to implement the outcome document, but it actually talks about especially for the relevance to this meeting, disaster risk reduction, and also mental well-being, and also the importance of invisible disabilities, which we are dealing with here. So in this sense, the emphasis was such that there were a number of governments that repeated. I was at the informal negotiation before I went to India, and I just want to just emphasize this because many member states are there to really to take action, but they really want us to, for those of us from the academic community, those of us from the United Nations system, to really to help them to have specific options for next steps. So just wanted, I think it's an important point. And the resolution also sets out the periodic reporting on the situation of persons with disabilities. Currently, we have 5 years and two-year period, periodic reporting based on all the instruments I mentioned, convention, World Program of Action, and in relation to MDGs, in relation to the mainstream development framework. Now, from 2018, by the way, I think I provided copies of the draft resolution. You must be one of the very first one to see this, because it has not been made. I don't think it's been uploaded in the UN system yet. But this resolution talks about in 2018, if I remember correctly. Maybe you can correct me. You have the copy. They are going to the Assembly is requesting for flagship report on disability and development, which means that all the work that we do now for mental well-being, disaster risk reduction, and also monitoring and evaluation would be an integral part of such flagship report. So I would like to just to call your attention that perhaps what you do would in a few years will be directly relevant, and you'll be directly contributing to such report. I'm just also making a request, since we are the Secretariat to compile this report. And strong emphasis on disability data statistics, analysis and monitoring and evaluation. As I briefly mentioned, this evidence-based work is something that we all need to work on this coming years. As for our unit, for our work, we worked very closely with DFID last month in October. Based on the expert group meeting on disability data statistics and monitoring and evaluation we had in July, to really to look at where we are in terms of disability data statistics and monitoring and evaluation. And just to give you a very quick overview, what we've been lacking during the past decade is that in 2001, there was an expert group, not expert group like our group, but there was a expert body, which actually was established which is called Washington Group on Disability Data Statistics in 2001. And this group was, the mandate was to work with the UN Statistical Commission to assist all member states to develop disability data statistics in terms of prevalence and also in terms of disaggregation of national data to be able to produce again the analysis of where people with disabilities are in relation to the rest of the population without disability. So this was established, but the issue was that there was no institutional house for institutional support for this group. It was actually like an independently standing expert group. So DFID actually has taken initiative to organize this meeting and with us to develop a basis for institutional setting, which will be in our department, statistics division, to compile all of this information that has been gathered during the more than past years, since 2001, to be able to at least start providing globally comparable information, data on population of disabilities from different parts of the world. So this is now this is going to take place in the coming years to be able to say the population, basic prevalence of population with disabilities. Right, as of now, India says, for example, 2.3% of their population are disabled. And then Australia says something like 24% of their population are disabled. So we cannot even say that, we cannot even compare. We cannot actually engage in global comparison, the basic work we do as a United Nations system to be able to look at the situation of persons with disabilities. So this I thought was very important to also inform you at this time. Yes. So this was the second issue cluster, the normative framework, and most recently this General Assembly resolution just was adopted Monday, has also strengthened this normative basis that we'll be working on. And I would like to move on to just more practical dimension. So how can we perhaps advance this work? After this expert group meeting, after we generate a set of recommendations, and we have public forum tomorrow, and then we would have input from local community, which is Japanese community with enormous experience of disaster risk reduction policies, programs, and also practical dimension of work. So how can we take advantage of those wealth of experience? We have conference of states parties every year, and this year, just as an example, we organized a forum on disability-inclusive disaster risk reduction with Government of Japan and also disabled persons organizations, UNISDR, and us. And we also had the outcome document, which provided for a basis for this for my participation in this expert group meeting. And then we actually have now a lot of partners from this forum who actually are contributing to this issue of disaster risk reduction and also mental well-being. So this is one area that we can one specific mechanism that we can use to build on this issue, on the recommendations. UNICEF, UNDP also already has programs, so we can also work together. And perhaps what we could do is we can have interagency working group on mental well-being, mental health, and disaster risk reduction, together with our UN colleagues. I would also like to mention in this context that I think my colleague from UNISDR may perhaps provide further information, but there was such a thing as an International Organizing Committee on Disability-Inclusive Disaster Risk Reduction, and it became very active since this summer. Especially after our DESA forum and after our discussion with disability organizations, we actually had a number of stakeholders which have more experience in international policy processes. And they actually got together in Geneva to impact on the Hyogo Frame of Action, the text of the Hyogo Frame of Action number 2, to be actually adopted at the Sendai conference next year in March. And they have worked closely with government, Japanese government, government of Thailand were also leading, and there were DPO, disabled persons organizations representatives like IDDC and IDA and Rehabilitation International, who were very active in that negotiation process just this past week in November, second week in November. What the result was that they worked with government, they worked with the government of Japan, they worked also with the government of Thailand, and they also worked with our colleagues in UNISDR to facilitate by this process to benefit from the specific options for inclusion of disability in the outcome document for the Sendai conference, which is Hyogo Frame of Action 2. And so, as is now, we received like very good news last week that this draft text includes disability at this point. So I think this is another entry point for mental well-being and disaster risk reduction to really to flesh out what it means to be disability inclusive. Because whenever there is a reference to disability inclusion, disability inclusive, disaster risk reduction, resilience, I think mental health should just go right in, and that, I think, should really require our expert input, for immediate impact, as well as more fleshing out of options of how to do it, and then also bringing that ideas to public forum or UN forum or different conferences, so that it's repeated many times. So that was something you can already think about, in relation to what is taking place at the international level in relation to disability inclusion in disaster risk reduction. Next week, we have International Day of Persons with Disabilities, which is 3rd of December. But in general, we call the week of 3rd of December as International Day of IDPD's Week. And the 2nd of December, the panel discussion will be held in collaboration with the United Nations University and the World Bank Tokyo Development Learning Center, as well as Government of Japan, and Rehabilitation International. There are other DPOs that are supporting, and an NGO Committee on Mental Health, and we're organizing a panel discussion on mental well-being, disability, and disaster risk reduction. So we hope that what we do here would also be fleshed out in a context of this meeting, this panel discussion, in conjunction with the International Day of Persons with Disabilities on the 2nd of December for this particular meeting, a particular panel discussion. So yes, in the past we also used this kind of International Day and also conference stage parties, side events. So we should continue to use such entry points. So next steps, we need to, include disability risk reduction as an integral part of post-2050 development agenda. We need to talk about practical steps. I think, and I'm just repeating myself at this point, because what we do needs to be packaged, and then the package needs to go everywhere. And then everywhere meaning starting the big conference to expert group meetings, to International Day events. I think we have many opportunities, but I think it's really up to those of us who have this expertise, and those of us who have official mandates to advance this issue. So I think I would like to stop there, and I would like to continue with our discussion this coming few days. Thank you.